Professor, what are the forecasts of cancer treatment, particularly breast cancer treatment with immune therapy? What are the forecasts?
Well, immunotherapy is a new modality.
Это новая модальность иммунотерапия.
This kind of immunotherapy that we're doing now, what we call the checkpoint inhibitors,
Та, которую мы сейчас в настоящий момент проводим,
with new
называется
drugs,
ингибиторы контрольного пункта
with new
пропускного.
drug, with new kind of drugs
Здесь используются совершенно новые инновационные препараты медицинские,
that primarily showed a good results in melanoma patients,
которые в первую очередь показали свою эффективность в
where
случае
a
пациентов
very
с
high,
меланомой.
significant portion of patients with stage 4 melanoma
Причем достаточно большой процент этих пациентов находились на стадии, на последней, на четвертой стадии меланомы,
that before survived a few months,
которые ранее, когда это лечение не было доступно, выживаемость составляла около
today
нескольких
survive many years
На сегодняшний день такие
and
пациенты
even are being
могут
considered
продолжать
cured
жить много лет
by using immunotherapy,
и могут даже
things
излечаться,
that we didn't see before.
проходя лечение иммунотерапии. Это невиданная практика, ранее такого не было.
Later, then it has been checked in kidney cancer,
Параллельно, после чего, после меланомы, эффективность иммунотерапии проверена на раке почек.
again showing very nice response and long-term survivors in stage 4. I'm talking about patients with stage 4 disease that before survived a few months or a few years only.
Очень хорошую реакцию со стороны пациента на
And-
терапию и с хорошей продолжительностью жизни после прохождения лечения. Опять же, я повторюсь и сделаю акцент, что я говорю о пациентах, находящихся на четвертой стадии болезни.
And more recently, we have good results in lung
Последние
cancer,
результаты применения
in
иммунотерапии
head and neck cancer,
показали хорошую
in
эффективность
skin
иммунотерапии
cancer,
в лечении рака легких,
many other
почек,
diseases,
головошей,
bladder cancer, for instance,
заболеваний, например,
hepatocellular carcinoma of the liver.
например,
Well,
также
not
рак
the same,
печени,
not the same proportion of patients that respond like in melanoma. However,
процент пациентов, которые имеют настолько
say
же положительную реакцию,
up
как в
to
случае
say about
меланомы,
20% of the patients
скажем,
respond,
20% пациентов
and those that respond for a long time. Respond to the treatment, and those who respond for a long time.
В этих случаях 20% пациентов показали положительную реакцию на эту терапию, и более того, продолжительность эффекта этого лечения долгосрочная.
Now, this field is expanding.
И эта сфера типов расширяется.
Many more
Увеличиваются
molecules being developed.
иммунотерапия. Появляются
A lot
новые
is
молекулы.
invested in clinical research.
Больше инвестиций вкладывается в клинические исследования.
Today we presented all the basic scientific background and also the clinical experience in lung cancer and urological cancer.
Научный опыт
And
с точки зрения рака
Really,
легких.
the news are coming on a daily basis,
В
actually.
принципе, каждый день приносит что-то новое.
And it is so significant that sometimes, I've been in the field of oncology almost 45 years.
Я работаю в сфере онкологии практически
Well,
45 лет.
And now, at this point, you need to change a few stigmas and a few, what can I tell you? You work in a certain way, and then you need to change. You think, listen, it's a different way how to manage the patient. It's a new way of thinking.
Надо по-новому думать, надо менять
You need to be very flexible to adapt yourself to other modalities and to other approach how to treat the patient.
новым подходом к лечению пациента.
And it's very important, but if may I just add, it is very important we have meetings that we had today here in Kiev, and I'm so glad that we had so many people come to
Я
attend,
так рад, что сегодня столько участников.
because these things are happening on a daily basis, and we need to spread the news.
Каждый день, и мы должны распространять информацию.
I'm very glad that Lisod is, may I tell you, I'm very happy that the colleagues here in Lesod are applying this thinking to the patients that they see here in Lesod.
Применяют такой метод мышления к тем пациентам, с которыми они работают, которые приходят к ним.
And this is possible if you work in a team. You know, it's possible if you work in a team. It's, you know, look here. We have in a big team. You have people who specialize in lung cancer, kidney cancer, radiation therapy, and where to use and which kind of radiotherapy and when to use it, how to plan it, how to accommodate all these things. Really became very complicated, and you need to create cancer centers that can give the best chance for the patient.
Которые будут давать максимальный шанс выздоровления пациенту.
Повертаючись все-таки до раку молочної залози, пане професоре, скажіть, будь ласка, яким ви бачите вирішення цієї проблеми?
Going back to the breast cancer, still I would like to know your opinion. What's the future of this, particularly this breast cancer treatment?
Breast cancer?
Breast cancer, yes, because today marks Cancer Fighting Day in Ukraine, and October 15 was International Breast Cancer Fighting Day.
I think the messages in breast cancer are many.
Я думаю, что месседжей
But knowing the situation in the Ukraine, and specifically after receiving the good news that I heard when I arrived yesterday, they gave me good news that the parliament here in Ukraine, in Kiev, decided to do a reform in the medical system, and I think this is very important. So things that need to be done, number one is, which doesn't cost nothing, really nothing, is just to tell the population to be, to be alert and to know that breast cancer is treatable, that if you detect it at an early stage, the chance for cure is high and the treatment is easy. So we have to promote the population for awareness of the disease, the women population. This does not cost even a penny just to do this propaganda. It's, Number two, we need to develop in Ukraine screening programs for women, because screening has been shown in many countries to reduce the mortality from breast cancer. So you see here, I don't even mention targeted therapy and screening program. I'm just saying let's be aware. Number two, let's get screening by mammography and sonography. So this is not that expensive, and if you compare the price of the screening compared to the price of treating patients with advanced disease with all these expensive drugs, of course, it is better to invest in prevention and screening. And this is before all of this fancy medicine. Then, if you have early disease, then you can do limited surgery. And we need to have, we see in Ukraine, too many women undergoing mastectomy. While if you look at the patient, you could just remove the local disease, use modern radiation, and prevent the need for, and you don't need to do mastectomy actually. Frankly, in Israel we don't see that many mastectomies. Only a few, just when there is a need, but usually we see lumpectomies, local disease. This is the result of the screening, because we find them with very, very early disease. Then, in surgery, we need to abandon the difficult operation of doing the axillary dissection. Gives a lot of edema and problems, and all the morbidity from the surgery is because of this axilla. And now we have means
смертность от операции в случае рака груди происходит именно непосредственно из-за вот этой вот подмышечной железы.
So you don't need to remove all the lymph nodes, you just need to sample them. And I can tell you that Lisod was the pioneer, with Dr. Zhigulin, was the pioneer to this kind of, one of the pioneers, or maybe the pioneer, to this kind of procedure in Lisod, to avoid dissection of the axilla, just checking if there is disease, and then if there is nothing, you don't need to dissect, or you can irradiate instead.
Он проверяет, есть ли заболеваемость подмышечной области в лимфоузлах, нет необходимости диссекции.
Now, in terms of the general treatment, chemotherapy, we have modern agents, every day more and more modern agents to treat breast cancer. And we have the targeted therapies, Herceptin, Pertuzumab, TDM1, a few drugs that work on the HER2 receptor, very effective, and I think Lisod was one of the first to use this kind of treatments. And I believe these treatments should be approved in this country. Also, some agents that work with hormones, for instance, of course, the hormonal treatment is very old, but there are new drugs. But in addition, use drugs like Afinitor or Palbociclib, the new targeted agents that enhance the effect of the hormones. So this just, I gave you a list, but there are so many things. You look at in the Western countries, that with everything, screening, early detection, proper surgery, proper radiation, proper systemic treatments, hormone, chemo, targeted therapies, mortality for breast cancer is diminishing. And also the treatment is less mutilating. The women don't lose their breast, and psychologically it's very important. But this was just very brief things, you know. There are so many, like the genetics of breast. And we thought that the genetic aspect, like the BRCA mutation, we found it in Jewish people coming from East Europe. And we thought this is, they used to call it the East European Jewish gene. Now that we do more and more genetic testing, we found, for instance, what we call the Polish gene, that is, you can find it in West Ukraine. So we find non-Jewish people, women from West Ukraine or from Russia, that are carriers for the BRCA, certain mutations in the BRCA, which have the same significance like the Jewish BRCA. Yes. And this is with proper genetic testing, when you test not only the blood, but you test the tissue, the tumor.
What is the reason that you can find some mutations both in the west of Ukraine or in...
I cannot give you an answer. Why we find, for instance, the BRCA1 and 2 mutation you find in Jewish people, certain, I don't want to mention the specific mutation, but usually you saw it in East Europe, Jewish Europe, and in Iraq. And Jewish women from Iraq, you know, here is Iraq, here is Poland. Why? Why? You look in history.
And by the way, many patients of Lesotho, they are far away from being Jewish. They
Yes.
are not Jews.
But you see, for instance, in Lesotho, it's wonderful recommendation if you have a young, because where do you find BRCA? If the patient is young, less than 40, and if she has bilateral breast cancer, check for BRCA.
Если вы выявляете такого пациента, будьте уверены, что вы найдете у него BRCA.
For instance, moving to ovarian cancer, which goes sometimes with breast cancer.
Lung
No, ovarian.
рак яичников, перейдем к раку яичников.
You find a patient with ovarian cancer. If she's Jewish,
Если
40% chance
40%
that she is a carrier of mutation in BRCA.
является носителем BRCA мутации.
If she's non-Jewish, you still can find mutation in BRCA, and it's very important. Number one, because if you find in the mother, you should examine the daughters, because this is transmitted in the inheritance, you know. So you need to check the daughters. Then you need to check for breast cancer, because if you found BRCA, you also have to be careful on the breast, and also has therapeutic implication, because there is now a new kind of targeted biologic treatments with what we call the PARP inhibitors. PARP inhibitors. PARP inhibitors is a new biologic targeted agent that if you have BRCA mutation, these kind of drugs will be effective. Whether it be breast or ovarian and even pancreas, sometimes we find it in pancreas cancer, PARP inhibitors. BRCA mutation, and then you can try the PARP inhibitor for pancreas cancer. Yes. So there is a lot of activity, as you can see. These were just small, things. No, what I gave is just small examples, but it tells you that it is more complicated than we think. You need to have many experts because you cannot know everything. Today, you need to treat cancer in a cancer center, which has many disciplines, have many people, because one person cannot know everything.
А повертаючись до мутації BRCA-генів, скажіть, будь ласка,
Going back to BRCA mutation.
Скажіть, будь ласка, чи варто включати певні аналізи до скринінгових програм, які здатні їх виявити?
Do you think it makes worse or while to include some tests into mandatory screening programs for them to detect
Yes.
those?
If the patient is a BRCA carrier, mutation carrier, you start the screening at a very young age. Usually the rule of the thumb, say if the mother was diagnosed at the age of 40 and she has BRCA positive, you start screening with her daughter at age 30. If she contacted breast cancer at 35, BRCA positive, you start screening with the daughter at 25. Very important. And if you find the mutation, then after the woman said, I have enough children, I'm not planning more children, remove her ovaries before age 40 because she's a high risk to develop ovarian cancer. And as you know, for ovarian cancer, unfortunately, we don't have early detection.
Если вы знаете, что в случае рака яичников, к сожалению, нет такого понятия, как раннее выявление.
We can't detect it early. When we detect ovarian cancer, usually it's advanced. Doesn't give signs when it's small. So it's important with patients women that have a high risk to develop, say they are BRCA carrier, she has 2-3 children, she doesn't want to have more children, remove the ovaries.
Переносчиком BRCA мутации, у нее есть уже 2-3 ребенка. Мы тогда в этом случае, чтобы избежать риска заболевания раком, ей удаляются яичники. Как-то Лопес, да? Нет, не Лопес. Анджелина Джоли.
Well, she did bilateral mastectomy. And I'll tell you, this is the difference. I mean, one way, if you have BRCA mutation, you can do the bilateral mastectomy as preventive or to reduce the risk. But there is an argument. Some people say that instead of doing the prophylactic mastectomy, one can do careful follow-up. What do you mean? Once a year mammography and sonography, and once a year MRT of the breast. So every 6 months, one time MRT, one time mammography, sonography, every 6 months, and then if you do very careful follow-up, and you find the tumor very small, you can cure it if you find it very early. So there is a big discussion whether what she did was right. This is the American approach to do bilateral mastectomy. But say the European approach is less aggressive, and people would consider doing very careful screening
И людей направляют скорее, вот, скажем,
and
по
detect the
пути
tumor very early.
регулярного скрининга
It's an option.
для ранней диагностики.
Yes.
Пане професоре, в Україні є така проблема, яким дівчата дуже на
We are facing a
ранньому
problem in Ukraine. Girls, young ladies
хворіють на рак молочної залози, скажімо, це вік 25-26
are found
років.
breast cancer, and we're talking about ladies 25, 26 years
А
old.
вони молоді, активні, позитивно налаштовані на сприйняття життя.
They're young and dynamic, and they're looking ahead for their lives to go on with a
Вони
positive
не палять і
prospect.
дуже активні фізично.
They're non-smokers. They're physically active.
Чому
very
може бути
active.
така проблема? Чи це проблема виключно в Україні?
What
Чи
can be
це-
the reason of the disease? Or this is a problem typical for Ukrainian girls?
No, I think sometimes you hear about these cases, but breast cancer, the incident goes with age. But we know about cases in young patients. Some years ago, that was maybe 15, 20 years ago, we published
15 или 20 лет назад
a paper, an article in Israel, in the American literature, but it was based on data from Israel, breast cancer in girls.
рак груди у девочек.
This is very
Girls,
girls, less than 16. And this is very rare, extremely rare, but it happens. Now, breast cancer at age 25, 30 is also rare, it's not frequent. So sometimes you hear,
иногда
you hear about one case and it's very emotional, it's very, there is a lot of noise around it because it's so untypical, so you think it's not an epidemic.
люди начинают думать,
No,
что это
but
эпидемия. Нет, это не
each, usually people don't know, but somebody at age 50, 60, nobody knows.
50-60, да?
It's not, it's not unusual, it's usual. But on a 25 is very unusual and there is a lot of noise around, so you think, but there is no epidemic. Let me tell you, it's no epidemic of breast cancer in young people.
Скажу вам, что у украинских женщин нет этой эпидемии. Ukrainian ladies do not have this epidemic.
No, not everywhere, even in other places of the world. There are only few, it happens, but not to that extent. The incidence is, as the age goes up, the incidence goes up.
Процент заболеваемости увеличивается по мере старения женщин.
А рак молодіє?
В смысле, могут
Рак
ли
мол-
более молодые
Да.
же люди? Can you say safely that cancer is getting younger?
I'm not sure. I'm not sure. There is more awareness.
Я бы так не сказал. Дело в том, что осведомленность людей растет.
There is more awareness. People pay attention more to these things than before. But I don't see epidemic in young people. But certain diseases we see sometimes more. For instance, we see young people with head and neck cancer that never smoked because of the HPV.
Рак шеи, голова, и эти молодые люди никогда не держали сигареты во рту.
Same we see in more young patients with lung cancer now that we find that never smoked, keep good health, style, whatever, eat well and do sports, whatever, and get lung cancer. Usually it was discussed today, the young that never smoke and still develop lung cancer. So there are there, but not an epidemic. Not an epidemic in young people, absolutely no.
Я бы не сказала, что у молодого населения это можно констатировать как it's not a multiple case, rather.
Yeah, you see there are some diseases, but not that we see a big distribution or tendency that more and more.
Что это тенденция, я бы не сказала.
Пане професоре, ще скажіть, будь ласка, ви є співавтором видатних досліджень,
You
зокрема
are co-author
електронний
of prominent researches, scientific researches, particularly
електронний ніс. Скажіть,
e-nose. E-nose, electronic nose.
Yes, I'll tell you, I know. This work actually was done by Professor Hossam. He's a professor in the Technion.
Скорее всего,
And about 2 weeks there was an update in the in the local literature. For the independence of Israel, they mentioned a few scientists with that had whatever were famous for something. So they interviewed the person, and he continues to show.
В Израиле было интервьюировали ученых, которые имеют определенные достижения в той или иной сфере.
So his project continues. It collected more and more data that confirm his observations. Our part in the business was in the beginning, because when he came first with the idea, it was very appealing to me to cooperate and have, because our patients, it's a very easy test. They not just need to exhale to a sack of plastic and give the sample. And when he did this test, we saw really interesting results. But I'll tell you, it's at the same time, it's an anecdote. It was published in some literature that they checked dogs. And they were showing that, like, as if dogs can detect patients with cancer with a smell. And when I said to myself, and it's proven, you know, dogs can make diagnosis sometimes. They have, and we said, well, maybe there is a point, and we can detect certain molecules in the exhaled air that will help to find and diagnose. Now, if you look at the results of Hossam, very promising. However, I always said, it's interesting scientifically. I'm not sure that will have any value in current knowledge on the daily practice. Why? You do the test and you find, like, this air that the patient exhaled predicts that he might have cancer. So what do you do? What do you do? Where do you start? You do all the studies, colonoscopy, everything gets normal. So what do you do except for putting this person under hysteria? I think what you should do, if this study that he continues with them, you can use this maybe test to monitor patient. For instance, you have a patient with cancer, with metastasis, stage 4, he does the test, this is the level of the concentration of the molecules, you give him certain treatment, and you can follow and see if these molecules decrease in percentage. Could be an option. But in the current knowledge, I am not sure that you will be able to base a diagnosis to remove somebody a breast, you know, because the study shows a positive thing. See what I mean? It's too early, it's interesting, but I'm not sure whether it will remain in the lab or become into a daily practice. But we're very happy that we helped him to start this project, because we were looking for a big center with many patients that you can test this technique. So we have hundreds of patients, and we had 3,000 patients coming, new patients per year. So we had many patients. Everybody wanted to participate and do it. Very easy. You don't even need to do nothing. Just you do like that. You get like a balloon. You get a balloon. And that's it, that's the whole test. Then we receive telephone calls from the patient, what is my result? And I tell them, I'm sorry, we cannot tell you, because it's a research, we don't know the implication, it's kept secret. It's only when they look at the whole figures, they can tell you something, but on the individual case, it still is research, we don't have any value. With electronic nose. Yep.
This is it. She volunteers herself for someone who will make this test.
Yes. Professor Hossam in the Technion in Haifa, go to his lab. But it's still in the level of investigation. Very interesting, which are these molecules, whatever, but still investigation. You're more than welcome.